On November 3rd, school nurses and athletic personnel from across the county gathered at the Middlesex District Attorney's office to learn how to administer Narcan, medication used to reverse the effects of opioid overdoses.
I think we have about 15 or 18 schools that have sent folks here today.
Who will be administered this in the school?
Well, those folks who are here being trained, nurses, athletic directors, coaches, whoever may be. We've got a couple of assistant principals, whoever's here today.
And so we also wondered, were there cases before? Why do we need the Narcan right now in the schools?
Well, I think because we all know unfortunately, the number of overdoses is growing across the country. Narcan is a safe way to reverse the effects of an overdose. It saves people's lives. It is not treatment, it's not prevention, but it is an immediate intervention that can save lives. And, what our hope is that when we're able to do that, that gives a person another day to be able to seek treatment and start addressing their addiction.
Dr. Daniel Mills was invited to lead a tutorial on the use of Narcan. He addressed the function of Narcan and the importance to the school community of preventive education.
If you give into an old narcotic overdose, they will respond to it. Not only will they respond to it, they'll start breathing again on their own. If you give it to something that is not an overdose, it has no effect. It is the equivalent of shooting saline up their nose. And the impact that you have on the kids, who knows them better? Who can make a difference? And we have to educate the kids, we have to educate the teachers, we have to work with the coaches so that they understand the risk. It's preventing it. If we do not get it off the streets, if we do not change how we perceive use of narcotics, then this problem isn't going away.
A school nurse from Arlington was there for the training and acknowledged its importance in enabling her to share this essential information with her school community.
I think this is a great addition to our emergency protocols that we already have in place with standing orders with epinephrine, with our life-threatening allergies. It's a good resource to know that we have in the event that we would need to use it. We have it and we can give somebody a second chance. Yeah, we are in rollout, being able to get the training, then turn around, educate more in the community, in the schools, so that everybody has the knowledge and the awareness that it's there.
For parents, teachers, you have to be well aware that something could be happening. Don't try to convince yourself it's something else. If it is, great, but if you think your kid has an addiction, you better make sure that that's not the case before you try to say, well, it's just his age or his behavior.
According to Arlington Schools Superintendent Kathleen Bodie, Narcan has not been used in Arlington schools. However, the school resource officer and nurses have been trained in the administration of Narcan, as, according to Dr. Bodie, the school system, quote, moves forward in being prepared to offer this life-saving drug should the need ever arise. For more information about the proper use of Narcan, please go to the APN website for full coverage of the training section. For Arlington Public News, I'm Koala Shea.